Senator Cassidy, you are recognized for 3 minutes.
Mr. Ledoux, I see your last posting was at Barksdale, but nonetheless, a name like Ledoux, you had to be originally from Louisiana or maybe New Hampshire.
We're down. We live in Louisiana, right there.
Well, hats off to you.
Thank you.
Yeah, I was looking up. I was trying to look you up on the internet, and I didn't see that. But again, and I was looking your testimony in total agreement with that which you've been speaking of. I'm a physician, and I always know that healthcare, which is closest to the patient, is healthcare most likely to be delivered. And so your kind of advocacy for community clinics for those who've used VA services, great thought. I have folks back home who have to go 100 miles for the colonoscopy after taking a prep. As a gastroenterologist and as anybody who's over 50 can understand, that can be problematic. So without being more explicit. And there's also the issues of timely payment for providers, because if providers are taking care of folks and they don't get paid, they can't meet their margins. And ultimately, if you can't meet your margins, you can't see patients. Just saying that as a fellow who worked in the public hospital system, but knowing those who work in the private. Love your testimony. For those concerned about the gender issues and women being able to get their care addressed, in total agreement with that. As I, again, looked on your website, and I noticed about half the faces on your website are female. And I think that shows our changing military. And women have just the privilege to serve as men do in some of these roles that formerly were just for men. So our VA should respond to that. I thank you all for your service and put myself at your service as we work in common for the good of those who have served our country. Mr. Chairman, with that, I yield back.